Yo, yo. All right. What's up, everybody? Why clams are hurting your patients. So, if you are new to following me, I'm a physical therapist in the Tampa Bay area. I've published statistically historic papers in the field of orthopedics, and I'm a clinical expert. And one thing that comes up, I don't have a normal clinic. Most of my patients have come in here and they tell me I've failed everything. Nobody knows what's wrong with me. And I treat SI joint, sacral torsion, shear all day long. And inevitably, when I ask them what they did at their last physical therapist, inevitably clams comes up. Okay. First of all, I believe clams to be an absolutely pointless exercise unless you have the innovation to the piriformis, the external rotators of the hip. Absolutely pointless exercise. I would never do that with my patients. I do unilateral strengthening, usually the right side for sacral torsion, but I don't do bilateral. And the reason why, my clinical reasoning is this, is so with chronic low back pain. Okay, so years ago, I started seeing, it shocked me. Years ago, I started seeing patients in here. I honed in on the SI joint and sacral issues around 2009. Years ago, I started seeing patients in here and they're crying. They tell me they want to, and I'm sitting, and they've been to the most prestigious hospitals in the United States, and they were prescribed psychiatric medication for psychosomatic pain. And I realized I had a whole clinic full of fakers with the same problem, same like constellation of symptoms, right? So I started looking, and one day I was like, oh my God. I'm like, all of these people, they don't even have the same problem. They have the same 3 misalignments causing this problem: upslip, outflare, and a sacral rotation to boot. And the sacral rotation usually went the same way, right? So I was like, excuse me. I went back to my books and I'm like, well, what muscles can I stretch? Can I strengthen, to stabilize this and put this into the correct alignment? And anyways, I created protocols that I just told you. I published my first paper in 2020, not my first paper, but my paper in 2020 called Root Cause of SI Joint Dysfunction, proposing that SI joint dysfunction is caused by an upslip and or outflare of the pelvis. I find it's bilateral outflares in the chronic pain world. And then they usually, I find, have a sacral torsion with the right piriformis being weak. And that's what I do basically all day long. And these people have spent $20,000 to $120,000 and been gaslit by the medical community that it's in their head or some mild herniated disc that they can't stand up, And so, anyways, so I started honing in on this, and then my whole clinic like turned into this condition, right? So most of my patients have seen countless physical therapist type thing, okay? And I'm sitting there, and over the years I ask him, like, what'd you do at your physical therapist? And inevitably clams comes up, okay? Inevitably clams comes up. And I'm like, and they're like, that hurt me, man. And I'm like, yeah. I'm like, that's like the exact opposite of what I would do to you. So what clams is doing is strengthening your bilateral piriformis. But these people which I believe, in my clinical observation, is the most common cause of back pain. I said that, and about a year ago, I started like, this is crazy. This is all I treat all day long. And boom, 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 boom. Under when I said that was like all the comments from my students that are like, I'm with you on that one. I'm with you on that one. I keep opening up SIs, and sacral issues, and boom, these people's chronic pain are gone, right? And then we stabilize it. So when inevitably clams comes up, they're strengthening the bilateral external rotators. But if you test these people, they usually have a right piriformis weakness, okay? Because their tailbone's twisted, okay? So you have to twist it back by doing bilateral, like nothing's happening, like you're strengthening both of them, but test these people, put them on their back and do a 90-90. And with people with chronic low back pain. And I believe you'll find that the right piriformis is weak, okay? Now, let's get to the part about SI joint dysfunction. So in my paper that made medical history, statistically in readership, according to AI, I propose in there that SI joint dysfunction is caused by an upslip and or outflare of the pelvis. Okay. Now, if somebody has bilateral outflares, think about it biomechanically. Where's my bum? Bilateral outflares like this, okay? You're going to strengthen both piriformises and lock it down even more. Huh? And that's why these people are getting injured at physical therapy offices, is because they're strengthening and that's why patients tell me that I went to this physical therapist, they had to do this exercise, and then, I couldn't walk after. You're locking it down even more. The piriformis needs flexibility to create space with the outflares and adductor strengthening to lock that in, okay? But they usually have a right-sided piriformis weakness, okay? And with a right-sided check me on it, man. A right-sided piriformis weakness, so one of the best exercise that I find to isolate it is to give them a red rubber band. I find red because some people can't do it, but it still works for people that, can do it. But a red rubber band tied to the, keep the thigh on the mat and bring the sole of your foot to touch your opposite calf, tie it to like a bedpost. Okay. And I have them start off with 1 set of 30, work up to 5 sets of 30. By the time they hit like 3 sets of 30, if you check their sacral alignment, the way that in my diagnostic method that I created, that I published, it's on my website, weltmethods.com. And by the time you check these people, what you'll find is that their sacrum's stable when they have a right piriformis weakness, which is basically always I find in here, is that their sacrum is now in neutral. Okay, that's not the issue anymore. But they still have an upslip and then usually bilateral outflares in the chronic pain world, I find. Okay, so and then you have to open, you have to stretch the bilateral piriformis muscles. Okay, now can you stretch and strengthen the piriformis at the same time? Yeah, do it all the time, not a problem. Okay, you can create flexibility and strength at the same time. Okay, a lot of people think you can't do that, but try it. The thing about our profession is that we're not like theoretical physicists, you can just try it, it's not theory for us. It's something that we can do and test out. We're like sculptors. I view myself as an artist, a sculptor. And I find the position, like in posterior impingement syndrome of the shoulder, I find the position, it's usually posterior inferior glide. I published that too. Posterior inferior glide. And then in a 90-90 test, and then I just create that like a sculptor would, So you can test this stuff. It doesn't have to be theoretical for you. I have a very different process than everybody else. To me, it's not to me statistically, it's a medical historical fact that most studies are wrong. In fact, in med school, a lot of MDs say I was taught in 3 years everything we teach you would be wrong. Well, it's the same thing here. Just go through it. Mechanical traction, core stabilization, therapeutic ultrasound, which I thought was a sham even when I was a student. So the things that we're being taught, you can't just live your life out of a book. I will look at a meta-analysis. I find those to be accurate in the long run, but I won't go from study to study to study, I'm not interested in that because it's to me, this is something, a practical, it's a practical application of your clinical skills to actually get the person out of pain. And when you get the person out of pain, then especially with these mechanical issues, by mechanically moving their bones back into alignment, then you create that. Okay? People overcomplicate this physical therapy thing, rehab thing. To be honest with you, my students will tell you the same thing that use my protocols. I post their stuff all the time, is that they don't find this thing to be overly complex. They just use I hear from people all the time that message me and they're like, I just use your protocols, man. Just use your protocols and I stay out of the way of it. Good for you. That makes me happy. So listen, if you want, everybody's looking for a mentor, especially new grads. Although new grads, to be honest, are kind of tough for me to teach. And the reason why is because you just spent $150 grand learning the latest research, right? You're learning the latest research. And then a guy like me comes along and I'm like, yeah, don't do that. Do this. So it takes them about 5 years to decompress, if we're being honest, in my clinical experience as a teacher. It takes them about 5 years of sitting with Mrs. Jones, who's crying and doesn't know, where to turn to because no one can help her with her pain, and you're doing what they taught you in school, and you're not willing to, I find not every once in a while somebody surprises me, but they're generally not willing to kind of deviate from that. And I mean, you just learned 150 grand worth of education. To me, a lot of it's nonsense, but I mean, I get where you're coming from. When I got out of school, it took me about 6 months of trying what they taught me in school, and I'm like, yeah, it's not working. Like what, half my patients aren't getting better? Like, how is this okay? I'm like, no. I threw the book out and I said, I need to figure this out. So I started, like I said, we're like artists and sculptors. Like we can figure things out, especially in mechanical issues, Oh, this makes it feel better. Stabilize it, stretch and strengthen muscles to make it feel better for them, lock it in with them. Okay. Now, if everybody's looking for a mentor, okay. And what I do is I created a clinical mentorship. Okay. My goal is to make people experts in not just regular pain, but chronic pain. Okay. My goal is to make people experts. So if you are looking for a mentor, comment expert below, and I will DM you more information on my clinical mentorship program. But you get all my courses at a 59% discount. And I teach weekly new, more advanced understandings of the body and rehab. Okay. And then also, a lot of people are starting to realize through my posts is that I have a hybrid clinical business cash-based clinic, 7 figures, 20 hours a week, which like I talk to people all the time on the phone, and that own cash-based clinics are struggling. By the way, you're getting gaslit. If you go online, they say social media like deceives you and it makes you depressed, right? And makes you think like you're failing in life type thing. Is I would go online and I would be like looking at all these cash-based coaches, right? And they're posting like this person increased $50,000 in 6 days, and it's like, geez, man, I'm just struggling to, pay my bills, Well, when I started cash-based business coaching to my 7-figure, 20-hour-a-week program, hybrid clinical skills go with it, the most important part. And when I started doing that, I started to get on the phone with these people that are in these programs. And they're struggling to pay their bills, man, and they're doing exactly what they're teaching them to do, and they're struggling to pay their bills. And I'm sitting there and I'm like, social media is gaslighting people there, and everybody posts their wins, like nobody's posting the losses. Like in my clinic, it's summertime now, and in summertime things slow down, and it just is what it is, like it's seasonal, especially in Florida, because we have the snowbirds, right? So it just is what it is. So generally you're not crushing it in the summertime, but nobody talks like that. Everybody's just like, yeah, you should be making, $100 million in your cash-based physical therapy chiropractic clinic, and that's not reality. I'm just, it's nauseating to me to hear stuff like that once I realized what was happening. So what I do differently is I teach people how to be super specialists in chronic pain, where my students tell you, my cash-based business clinical students tell you, I don't have competition. In fact, I literally refer out more patients than I accept. And so I'm not saying that out of ego, it's a statistical fact of my clinic. And the reason why is because people that are shopping for physical therapy or chiropractic, but people are shopping for physical therapy as a physical therapist, they're not going to work with me. Okay. That's the math to 7 figures, 20 hours a week. I literally send them down the road to somebody that takes insurance and that does my methods. Okay. People that are and I show you how to target and market to these people that I figured out over the course of 17 years with certain conditions, and I show them what's wrong with them. Um, I show them I understand what's wrong with them. And I would say 75% of my patients walk in here, they're like, dude, I have that condition you're talking about online. And I check it, and I'm like, yeah, you have it. You know? And I get them out of pain. No sales techniques. I don't do sales techniques. I'm not a natural salesperson. What I am is authentic. Somebody asked me the other day, what do I need to know about working with you? Now, in the cash-based clinic world, they get, well, we'll get you back, they dangle a carrot, we'll get you back to your running or pickleball, whatever it is, right? You know what I said to the person? I said, this is a lot of work, and it's going to take a lot of time, can take months. Now, cash-based industry would say, why would you say that to a patient? Because patients find it refreshing when people are honest with them. That's why. Is because I'm not trying to hoodwink people. I tell people the truth. And when you do that, the dynamic changes. When you tell the truth to people, people find it refreshing. People have written online about me in my clinic. They're like, this guy is brutally honest with you. Yeah, I am, actually. Because I find when you're truthful with people, guess what? They trust you. So, and you should be truthful with people anyways. Anyways, that's that. All right. Click comment clinical if you want to if you want to be part of my clinical mentorship, where I mentor you weekly with 59% off all my courses. And then if you want to join my hybrid clinical cash-based 7-figure 20-hour a week mentorship, comment hybrid below. I will DM you more information on that. Peace, love you.